Hi everybody, thank you for joining me again for one of my video diaries on the run up to my hip surgery. So today is Monday, surgery is Wednesday. We got a call today from Practice Plus to say that they want me to be at the hospital for 6 o'clock in the morning. I had patients till 8 o'clock the night before, so that's going to be fun. But I don't think we'll be sleeping very heavily the night before anyway, so that's absolutely fine. So it's all full steam ahead for Wednesday, which is really exciting. Today I have been in clinic since 9:30 this morning, and I've just kind of finished now with notes, and you can see all the kidney dishes have been sterilised and are out behind me again. So yeah, it's been a really full clinic today. I think I've seen at least 3 physio patients. I've done, I think, 2 dermal fillers, 1 Botox, microneedling, chemical peel, vitamin B12 injections, so pretty much everything today. Oh, and skin boosters, yeah. So I've pretty much covered everything that I do today in clinic. It's been a really busy clinic, but really lovely. The really lovely thing is that pretty much everybody that I'm seeing is booking in again for the week commencing 7th of July, when I'm hoping to be back in full swing with my clinic. But all my patients have been brilliant today, and kind of saying, you know, if you're not up to it, then we'll simply delay our appointments, which is really, really good. I think something that I've discussed with quite a few patients today, and also with James and with other people around me, is the subject of anaesthesia. So for a total hip replacement, there is, at Practice Plus anyway, the option of either a spinal block with sedation or general anaesthetic. Personally, I'm really leaning towards general anaesthetic, just because the idea of being sedated and still feeling myself being pushed and pulled about, being able to hear even with headphones on, drilling, banging, sawing, doesn't really fill me with a great lot of confidence or or comfort in terms of surgery. I would much prefer to be completely out for the count. And also, as I've mentioned to people, I've observed several total hip replacements in my time as a physio, so I know exactly what they're going to do. I know exactly what it entails, and how brutal it is as a surgery. I mean, it's pretty, there's a lot of sawing and banging and nails and drilling that goes on. It's intense. It really is intense, and I would much rather be completely oblivious than to be aware when that's happening. That said, one of my patients today was talking to me about it, and actually she had a really good argument for spinal block, which I hadn't really thought about. And she said that what she was told, I mean, she still went for general anaesthetic, by the way, but what she was told is that when you have general anaesthetic, when the general anaesthetic wears off, it's almost instant, and then you're instantly in severe pain, and obviously you need them to get to you to manage that pain for you quickly. Whereas with the spinal block, that pain wears off more gradually, and you're able to manage the pain more efficiently. So I thought that was quite an interesting thing that she said to me today. But at the moment, sitting here as I am now, I don't want spinal block. I want to be completely oblivious. But of course, I'll be open to discussing that with the surgeon. And the nurse on the phone today said, that's absolutely fine, it's patient preference, so you can discuss it with your surgeon or your anaesthetist on the day, and decide the best course of action for you. I will be staying in overnight, and hopefully, all being well, if I've responded well to surgery and I'm doing well afterwards, I'll be back home on Thursday at some point. So yeah, and that's where we are. I'm about to clock off now. I've just finished notes and straightening the office today, the clinic today, from treatments. I've got patients throughout tomorrow as well. A lot of my patients are timed appointments, so I need to see people 1 month apart. Simple, excuse me. Simple injections like B12. Most people benefit from having them monthly. Microneedling, skin boosters are all recommended to be once a month. So a lot of my clients and patients are looking for a treatment to be a month apart. So I was trying to see as many people over the course of today and tomorrow to manage that time frame for people as possible. And everyone's been lovely today. Everyone's been really, really lovely. I'm very lucky. So that's it for today. Yeah, and that's just my thoughts on my anaesthesia. And looking forward to a busy clinic tomorrow to keep me busy and keep me from thinking about the following day. And I'll check in with you tomorrow to let you know what's going on then. Thanks for watching and listening.